Welcome to Suburban On Air. On Sunday, November 29th, the Jaclyn Fisher Education Symposium in memory of Jaclyn Fisher will be taking place virtually. It's a free event with a fantastic lineup of medical professionals from Quebec, Ontario, and BC. I've gotten to know the Fisher family over the last couple of years, and even though I never met Jaclyn, who had Crohn's disease, she was clearly a very special person, and her parents have really made sure to leave an important legacy for her. Topics on this online session, which you'll see advertised in the description box of this video, will include preparing for your appointment with your gastroenterologist, fertility, an IBD, nutrition, mental health, transition of care from pediatric to adult, and much more. Two of the speakers will be Dr. Gad Friedman from the Jewish General Hospital and Dr. Marta Dirks from the St-Justine's Hospital, and they join me now. Welcome.
Morning.
Good morning.
Great to have you here, and we're doing this interview early in the morning so the doctors can get to work. So first, my traditional question on the medical topic like this, Dr. Friedman, how can you best describe for people watching this video who are not familiar with what Crohn's and colitis is?
To put it simply, Crohn's and ulcerative colitis are, like we said, inflammatory bowel diseases. So you get inflammation of the intestinal tract, and that inflammation can lead to a variety of symptoms such as pain and diarrhea, blood in your stools, and so forth. There's two different types, as you mentioned. There's Crohn's disease and ulcerative colitis, and the real difference between the two, again, could be put simply that ulcerative colitis only causes inflammation of the colon, while Crohn's disease affects the whole digestive system, really from the esophagus all the way down to the bum, and although primarily affects the small intestine and the large intestine. So that kind of would summarize it quite quickly.
Okay, Dr. Dirks, you're at St-Justine, so pediatrics. How young do you see people getting Crohn's and colitis, and is it more difficult for it, on a child than it would be on an adult getting it for the first time?
Well, in pediatrics, we have a sort of almost a third category of inflammatory bowel disease, which we call very early onset IBD, which are specific subtypes of IBD that are sometimes associated with immune deficiencies and very specific genetic mutations. They're very rare, and those can present as young as 6 months of age.
Wow.
But yeah, the majority of patients that we see present in the teen years, though, fortunately, with an average age of onset of around 15. And that's a tough time, when you're being a teen growing up and you have enough to worry about with school and your friends and who you are and what your identity is, to add on to something like that, Crohn's or colitis. It's a specific challenge for that age group. So wide range of ages, but most in the teen years.
Okay, very interesting. I'm going to ask you each the same question, starting with Dr. Friedman. How has COVID-19 affected your practice right now?
Well, on the adult side, well, everything has changed in the sense that we're doing everything by telephone calls, right? So almost, I guess, definitely over 90% of my patients is by the telephone, discussing things with them, which is both funny thing is both a positive and negative, right? So it's positive because it's been easier for patients to be able to be seen by the doctor. They don't have to run to the doctor's office, so they can be caught anytime during the day. The negative as well, though, is that you lose a little bit of that in-person feeling, which Zoom kind of captures a little bit of that, but it's still not the same as seeing them in your office right in front of you. So you kind of lose that patient-doctor touchy-feely type of things that are really such, we don't talk about them enough, but they're really crucial to taking care of patients. And I can imagine on the pediatric side, it's even more difficult.
Yes, Dr. Dirks?
Well, actually, some things have changed a lot and some things not so much. So in terms of early in the pandemic, yeah, it was very much online, Zoom, telephone interviews, endoscopy shutdown. That's one of my roles here, is to run our endoscopy program. But actually, as the pandemic has progressed and we've learned how to manage things, kids are not really that affected by COVID-19. So we're actually up and running kind of full steam here, almost as if the pandemic wasn't going on. with some provisos that there's pre-screening for COVID-19 before patients come for endoscopy, for example. And our clinic volumes are adjusted so that they have a limited number of people who come at once. And so I guess in terms of clinic visits, it's for us, it's about half in person and about half online virtual. And I have to say that it's nice, especially for teens to be, they're at home, they're on Zoom, I'm on Zoom on my office here at St-Justine, and they're a little more relaxed, and I can sometimes put the parents aside for a second, which is actually in that age group an advantage. So I think it gives them a little more autonomy, which is something that I'll talk about next week.
Very interesting. Now, Dr. Friedman, I know that there's traditionally a backup in normal times for colonoscopy. What did that first several months of the shutdown do to people who are waiting for a colonoscopy? Is it made the lineup a lot longer?
Well, quite dramatically so. I mean, this has really been a big challenge. And even now, we're not up to where we were doing beforehand. We still don't have we automatically, because of the rules of social distancing and pre-screening and so forth, it cut the volume that we can do during a day, by about, I guess, about 30% or so. And then obviously we were back by months because of the complete shutdown that we had. So that's already increased our waiting list. And truthfully, we still don't even have our full complement of nurses. So one of our rooms are still closed because of staffing issues. So we're really quite behind in our endoscopy. We're trying to do our best to catch up, but it's a catch up.
Because I know, Dr. Dirks, that, adults, children, some have to have colonoscopies at a regular interval. It's a risk if you don't. So obviously this is beyond your control, but it has to be a little bit of a concern.
Yeah, I think that you're right. That is a concern. We worked really, really hard at the beginning of the pandemic to actually re-triage all of our patients who are waiting for an endoscopy or colonoscopy for all indications, and then developed a new score of priority to make sure that the sickest people, especially newly suspected IBD, would still pass within a 2-week interval. So we've really worked very hard to prioritize new patients, active patients with a flare who need to have a repeat exam to decide on therapy, and to keep those wait times short. But that does mean that routine reevaluation of Crohn's or colitis is something that we've had to push back and to rely more on calprotectin and so on. So it has had an impact, you're absolutely right, but we've tried to make sure that those kids who are sick and who aren't feeling well get care in the shortest time possible so that they can get well and doing their activities ASAP.
Okay. Dr. Friedman, we're told people with Crohn's, and I'm among those, by the way. I've had Crohn's disease for over 30 years. I'm very, very lucky. I've had a very easy case, if I could say that. And it really hasn't affected my day-to-day life, but a lot of other people aren't so lucky. Nonetheless, we've been told from the beginning that those on immunosuppressive drugs are more at risk for COVID. Yet I've spoken to a number of people who have Crohn's. They're being obviously very safe, but is that the case? Have you found that to be the case, or no? Do you find that people like me are being extra careful listening to their doctors?
That's a good question, because it really has to do with the amount of information that we're being exposed to as time goes on. So, in March, when we first were talking about COVID, there was a tremendous amount of panic, and I think rightfully so. We just didn't understand exactly what this virus is about and how it's going to affect our patients. So we all gave them very stringent advice, be as safe as possible, as much as you can. We didn't really understand whether our immune suppressing agents would be, how much of a risk that would be for them. So we kind of warned all of them to be as careful as they can. As more information has come out, we've kind of realized that that risk is not as high as we thought it might be. And funniest thing is actually there has been trials on whether some of our drugs like Remicade could actually be helpful against COVID. So usually not increasing the risk, but potentially decreasing the risk, although those are in trial. So I wouldn't be recommending people to take the drug for that reason. But it's allowed at least to lessen the worry of our patients. But again, still being safe, doing all the right things like we were told to, washing hands, wearing masks, social distancing, always has to be done.
Absolutely. Dr. Dirks, and I'll ask Dr. Friedman as well to end our interview. So this symposium is going to be online. It's a new way of living right now. What are some of the things you're going to talk about on Sunday, the 29th?
Well, I guess, I'm very, first of all, I just wanted to say that I feel very, privileged to be invited to speak on this topic, and that the Fishers were in contact with me, and I knew Jackie, and she was a marvelous girl. And so that just, first of all, it's an honor to do so. And so what I'm talking about is readiness for transition. What are the determinants that let families know, let young people know that they're ready to transition from a pediatric to an adult setting? What can we do to help? What can they do to make the situation better? And how can they be best prepared when they arrive in Dr. Friedman's office or any one of my other colleagues, to know about their disease, to know themselves, to minimize their risk factors, and have confidence that this is the right time for them to move on to adult care. So those are the basic outlines of what I'm talking about.
Okay, and Dr. Friedman, yourself?
Yeah, I'm going to echo Dr. Dirks' honor of being invited for this talk. And I'm really also happy the topic that I got to talk about, which is really preparing for your visit. We talk about the patient-doctor relationship as being important, but in any relationship, both have to be very invested in making it work, right? So, I mean, I can't talk for my colleagues, of course, but at least patients, if they're better prepared for their visit, meaning knowing what information that the doctor needs and what questions to really ask the doctor and what type of answers to expect from your doctor, you really strengthen that relationship. And I think that's one of the, it's the first step actually to good health, is having your initial doctor visit going well, and every other doctor visit going well. I think a lot of people just don't get, the best care they can because they're also not coming in well invested or being a strong advocate for their health.
You're completely correct. My doctor is Dr. Albert Cohen, who we all know and love, and he's got a fantastic bedside manner. But the first thing he says to me when he comes in to meet me is, "What questions do you have?" And I, the night before, I sit down and I write my questions out, because you have to be prepared. Otherwise, you're going to walk out of there and say, "Gee, I forgot to ask for that blood test requisition." So you're completely correct, but not everybody does that. So I very much look forward to seeing the lecture. I thank you both very much for joining me, and stay safe.
Thank you so
very much.
Have a good day.
Sure.